Well, Dr. Jackie is back on today's Big Blend Radio Quality of Life show today to talk about heart health during the coronavirus quarantine. Dr. Jacqueline Eubany is a board-certified cardiologist and electrophysiologist and the author of the best-selling book, Women and Heart Disease, The Real Story. You can get on Amazon, all those great places. Now is a good time while you're sitting at home with your family to read it. And also go to her website, womenandheartdiseasebook.com. She's also based in Orange County. Dr. Jackie's got the Cardiovascular Wellness Institute of Orange County. She's in Orange and Irvine. And for that information, go to cvwellnessinstitute.com. And, she's been on our site and on our shows for a number of years now. And normally she's always talking about prevention of heart disease. And because really, especially for women, it is the number one killer of women in the U.S., killing more women than breast and lung cancer combined. In fact, I think it is, if you do the right things, if you listen to Dr. Jackie, we can reduce our risk up to 80%. So it's good stuff. But today she'll talk a little bit about that, but also look at the situation of what's going on with this the coronavirus quarantine. And Dr. Jackie, the coronavirus means that it really doesn't mean we get to have a six-pack of beer, right? Welcome back.
No, it doesn't mean you get to stay home and drink, but you should stay home.
Yeah. Stay home and the social distancing. I actually like to say physical distancing because it seems like social media and all that, we're glad we have these tools to keep in good spirits. When it comes to heart disease, first thing I wanted to touch on is high blood pressure and people getting their medicine, because I know you always talk about high blood pressure being really important. So this is something because it's a stressful time for some, to keep our stress down.
Yeah, it is a very, very stressful time, but you should make sure you're taking your medications every day. If you run out of medications, you really have to pick them up. I know that we're living in this era of coronavirus and social distancing and the staying-at-home mandate. But if you have run out of medications, unfortunately, during this period of time, you really need to pick it up. And I would suggest if you're elderly or have a lot of comorbidities and nervous about your infection rate, maybe you can have someone go to the store to pick them up for you, a younger and healthier person. But if you don't have anyone to pick up your medication, you really do have to go to the pharmacy to pick it up. I know that I've been to grocery stores recently, and what the grocery stores have been doing to comply with the stay-at-home mandate or decreasing the amount of people in the same room at the same time. They're limiting the number of people they're letting into their store so that there's a lot of space between people and so that you're not, in a crowded room. So it's most likely safe for you to go into one of these stores to pick up your medications.
So what about wearing masks? Because there's a lot on the Internet about the masks are effective. No, they're not. It keeps you from infecting somebody else, but doesn't keep somebody from infecting you. And I'm like, well, that makes no sense. It either works or it doesn't.
Well, the mask, is actually, if you do have a cough or a cold and you're not sure what it is, we know that the virus is spread by droplets. When you cough, you spit out droplets, and if this droplets gets into somebody else's mucosa, like their eyes, nose, or their mouth, they can potentially get infected. So what that mask does is just, keep all your droplets close to you so that you don't infect anybody. But if you don't have an infection and you're just wearing a mask, it really doesn't do much to prevent you from getting an infection, because you can still have, you can still inhale the virus, or, you can still touch your face and your eyes and those kinds of things. But, of course, if you work in a healthcare environment, they have these masks that are fit-tested to, decrease the amount of, viruses or air that gets within the mask, and it can decrease your infection rate.
Wow. Oh. So what about gloves? Does that help to wear gloves if you go into the store?
Well, this virus is very contagious because it apparently lives on surfaces for long periods of time. Gloves would be nice, but as you guys have heard, there's been quite a shortage of gloves in the United States. But washing your hands is extremely effective. If you wash your hands for 20 seconds, if you touch, when you touch surfaces outside of your home, 20 seconds of washing your hands is just as effective as wearing gloves. So I would recommend washing your hands.
Your face? Like, I was thinking about this going to the store because I'm like, I walk in and I'm like, I'm not going to talk to anyone. I'm not going to breathe. I'm going underwater, man. Like, don't look at me. I'm going through. And then you're like, you're getting like your fruit and vegetables. I'm like, okay, things are open. Do I need to like boil my orange? Because I'm like, my mind immediately goes into, I want to eat like as much vitamin C as possible. I don't know. Because I always think of the immune system, and we're very lucky where we are because we're in a smaller community in 29 Palms right now. We're in California now, Dr. Jackie.
Are
we're
you
closer.
in 29 Palms?
Yes.
Awesome.
Yeah, right outside Joshua Tree in the desert.
Nice.
And a smaller community, so very lucky in regards to the city. I know the city life is a little bit more hectic, but still I try not to breathe. And then I think, well, are other people's droplets going on my face? Are they going on my food? What about everything we bring back?
Yeah, well, you mean when you buy fresh fruits and vegetables? Of course, when you buy these fresh fruits and vegetables from the store and you bring them home, you just make sure you wash them. I think probably the 20-second wash rule applies to them as well. As long as you wash it, usually it's very effective in getting rid of the virus, and it should be safe.
Okay. And then, so washing and stay away from other people's droplets, unless they're wine.
That's why you stay away from people who are coughing or sneezing and things. Yes, because the droplets contain a lot of virus that's very infectious. That's correct.
Okay. Well, now with this, if someone has heart disease, right, and gets it, like what I was reading is like this is, it can actually be very painful on breathing in your lungs. And I know we've talked about how heart disease can affect your lungs. And so is this, do you have to be extra careful as, someone with heart disease or high blood pressure with this kind of this virus?
Yeah. So we're seeing now that the highest mortality rates from these viral illness from corona is most likely seen in patients who have a lot of comorbidities. That is, they have a lot of medical problems. So people with respiratory problems, heart problems, they just tend to have more severe cases or severe symptoms, and they have a higher mortality rate from this virus. So this is why we encourage people who are, who normally, are sick or have other medical problems, serious medical problems, to really, really be careful and try not to contract this virus as much as possible.
And now, what about doctor visits? From what I've seen and heard from friends, that it's more of your doctor visits have now kind of gone into what you need to have. You may not have your regular routines, maybe checkups, but it's really gone into where it's like the most important kind of things, but done mostly over the phone and maybe even video conferencing.
Right, exactly. With the advent of this coronavirus and the staying-at-home mandate, many physicians are now implementing what we call telephone medicine or telehealth telemedicine, which is where we either communicate with patients via the phone or we could do video conferencing. So we're allowed to have office appointments via phone with patients or teleconferencing or video conferencing with patients. This way, we're, again, sticking with the guidelines of social distancing and staying at home. And it's working out very well, actually, because this is what I was doing today, doing some video conferencing and telephone conferencing with my patients. And a lot of people are scared. They are scared. They don't want to leave their house. And the last thing they want to do is come into a clinic because they feel like sick people are in the clinic.
Absolutely.
So they're much happier when they know that we are offering these video conferencing sessions for them.
What about the longevity of the virus itself? I mean, we hear so many, like by Easter it's going to be gone, or, how do we even know that?
Yeah, we don't know that for sure. I mean, I think we're sort of basing some of this on what we've seen in China. Apparently, China hasn't reported any new cases. And I also heard today that Italy doesn't have any brand new cases. So it's either showing that, all of our social distancing and staying at home effects are really working where we're not transmitting this virus, or it could mean that the virus is going away. It's hard to say. But we will learn more as time goes on.
But do we even know where it really, really comes from? I mean, we've heard it's from people who eat bats and snakes, and we've heard so many weird things. Do we really know where it actually comes from? Do you think?
I think from what I've read a while back, I heard it also comes from, weird animals. It was like an animal kind of virus. But it started in, I guess, China. Maybe they were eating these, animals. I'm not sure. But it did start out as an animal kind of virus that somehow got transmitted to humans, either somehow did, and caused this whole catastrophe.
Wow. And it's interesting because then you think about, like, okay, so washing our hands. These are like basic things you're taught as a kid in school, wash your hands. And now we're all washing our hands, and I'm thinking about, like, how much you wash your hands. It's so, like, I mean, it kind of reminds
something so
me of
simple.
back in my days of playing guitar and how my hands would get trashed and, calloused and messed up.
Yeah, but it's still unbelievable that something so simple can be extremely effective in preventing such a virulent virus. So, we should always remember, sometimes it's just a simple thing, just like we say in cardiovascular disease, 80%, you can reduce your risk by 80% just by implementing some simple lifestyle changes. Again, a lot of times it's just the simple things that we know and that we do that can help us, that can prevent us from getting sick.
What about now, what I was saying that to me, first thing I do is like, okay, that's it, I'm eating a lot of oranges and, getting lycopene and all this vitamin C. My thing is like run for the immune, like, foods that you can get. And everybody's in a different situation depending on what they can get in their stores and even affordability. I know a lot of people are scared right now financially. And I think, okay, I'm just I'll eat as many oranges as I can, But then I think, does that help? And especially for, your patients, anyone dealing with heart disease or, hypertension, high blood pressure, that kind of thing.
Well, the thing is, since this is a brand new virus, we have zero immunity to it. Our immune system has never been exposed to this virus before. So if you get it, if you get infected, you will, get sick because that's the first time your immune system is being exposed to it and building immunity. So, I mean, eating oranges and doing all those immune things, I'm not sure if it would necessarily prevent you from getting sick if, your immune system has never been exposed to this virus before. It will still have to fight this virus.
It may help you fight it if you're healthier than the person who
well, if you're healthier, you can fight it a whole lot more than people who have other medical problems whose immune systems tend to be just weakened by their other medical problems, yes.
So then eventually, from the people who do get the virus and recover, will they be a source for antibodies, for vaccines, or something like that, do you think?
Well, they probably will. They will have antibodies to it since, they've been exposed and they've gotten so they will have antibodies because they've been exposed and the immune system has effectively produced antibodies to fight this thing. But I think right now they're working on vaccines, and I don't know if they're waiting for people to develop immunity first in order to develop vaccines from it.
Wow.
But for sure, if you've been exposed, now your body's seen this before and you have antibodies, and hopefully the next time you get it, it's not going to be as severe.
Wow, I feel like we're living in a science fiction story.
Like
it doesn't
like a
feel
movie.
like it.
It does.
Yes.
It's like a movie.
It's crazy, but okay, so now I want to keep going back into the stress thing because there is a stress level, I think, across the country and around the world, a stress level that's going up there. And I wanted to touch on that because it's something we talk about in prevention and heart disease all the time is, the stress level, calming down, going for a walk. Can people get stressed out that they start to actually give themselves high blood pressure that normally wouldn't because of the situation? I know people are worried about jobs, health, all kinds of things, and suddenly they're, they have their kids home for a month that they didn't plan on. It's like all kinds of things. There's a lot of stress going on, and that's what I really wanted to touch on. That what can we do to not do that, not go there?
This whole situation has just probably increased stress in many people's lives, like you mentioned, with kids, having to be at home. You have to figure out, daycare situations. You might lose your job. You're worried about all these stressful things. But there are ways that you can, try to decrease your stress during periods like this where you anticipate that it's going to be very stressful. I think going out and taking walks, because you are allowed to take walks as long as you're not in big groups. Going out and around your neighborhood, taking a walk, maybe relaxing when you come home, meditating, maybe reading a book. These kinds of things can help mitigate some of the stress that's going on with what's happening right now.
I agree, and you sent us on our challenge as part of our Love Your Park Stories. Nancy and I travel the country documenting parks. We're at 185 parks now, Dr. Jackie.
Wow!
Check that out, right?
That's awesome.
I know.
That
the last
great.
5 came in and all in one day because we knew things were going to start shutting down. We're like, let's go, quick. And we did get some walking in. Let me tell you. We do have our 1-hour walk challenge in our Big Blend community, and I want to tell you, I haven't added it up today, but I do know that we've walked at least like 80 hours since we started in January.
Oh, my goodness.
Between us and other folks, I got to give a shout out to Jim Ostick and Steve Schneikert, our Hollywood historian, really kicking butt in there too. So a lot of us are doing this. We've been, I think, covered about at least 18 to 20 different places around the world. Which is amazing. So we're doing this, and it's about going out and getting a 1-hour walk in. And I think the more we can do this, please join us because it takes a community sometimes to do that. And when we talk about social distancing, it's really about not being next to each other. We can do these kinds of things to keep our sanity and keep happy. Things pass. This too shall pass.
This too shall pass.
Yeah, take a walk on the wild side. It's spring. Dr. Jackie, it's spring. We shouldn't be cooped in.
That's right. That's what's adding to the stress level, Absolutely. Go out and take a walk and enjoy your neighborhood and enjoy the weather.
Yeah.
I think people should go build gardens.
Yeah, turn off the news and build a garden. Just like Lucas Nelson says.
Yeah.
Exactly.
If you have a place where you can garden, go do it. You can buy seeds online.
Exactly.
Yeah,
just figure out what you normally do to get you into that Zen place, and try to do a lot of that now.
Yeah, exactly. And make your home your palace.
That's right.
Really. No matter where you live, if it's a small, teeny apartment in New York City with a bathtub in your kitchen, you can still make it zen. Hey, listen, I know people with bathtubs in their kitchen, and they have a bubble bath and reach over and get their glass of wine off the counter, so it's all good.
That's starting to sound okay.
It's all good. Well, thank you, Dr. Jackie, for joining us. I know you're super busy, and we just really appreciate you, giving some insight, and we'll all calm down. We won't drink so much wine or beer, I promise.
That's right.
I'll behave. Everyone, again, Dr. Jackie's book is Women and Heart Disease, The Real Story. You can get on Amazon right now. Download it. You can get the paperback as well. Also go to our website, womenandheartdiseasebook.com. If you're in Orange County and want to schedule a call, whether it's in person or by phone or video, go to cvwellnessinstitute.com. It stands for Cardiovascular Wellness Institute of OC, so cvwellnessinstitute.com. And for more of Dr. Jackie's interviews and articles, go to blendradioandtv.com. She's one of our longtime experts, and we really appreciate her knowledge in getting us all healthy. So thanks so much, Dr. Jackie.
Thank you for having me. Stay safe.
You too. You too.
All right.
Bye.
Bye-bye.